Mr. Speaker, last evening I introduced you to a young girl that I have the honor of representing in northeastern Wisconsin. This is 3-year-old Kaylee Marinek. Kaylee and her family live in a trailer home just north of Appleton, and she receives care only because the United States Congress passed a Republican-inspired bill called the S-CHIP, the State Children's Health Insurance Program. And through that program, funds were sent to Wisconsin, and we created in Wisconsin a program called BadgerCare. BadgerCare guarantees that nearly 57,000 citizens throughout the state have access to health care. And because they see their doctor in their doctor's office, the costs for their health care go down. They are not seen in the emergency room, they're seen in the doctor's office. Kaylee gets health care because of BadgerCare. But BadgerCare and S-CHIP are in limbo. Their futures are in doubt. Why? Because this Congress is considering and will vote on Thursday morning whether or not to override President Bush's veto of this fundamentally important program that provides health care to millions of our children who are most in need across the country. The S-CHIP bill, which was vetoed by the President, guarantees that our children, the children of our nation, have access to health care at the physician's office. It focuses on those who are among us that need us the most, our nation's children. It is a private program because private doctors, private insurance plans, and private hospitals deliver the health care. It spends $3.50 per day for a child like Kaylee. But Kaylee doesn't live alone. She lives in a family and in a community. And allow me now to introduce you to her mother and her new sister. This is Kaylee's mother, Wendy, who is a food server. She's a waitress, and she earns $2.33 per hour and tips. She's working hard to support her family and lives with her husband, Keith, care of the children while Wendy is working. And this young girl, Cassidy, is 3 months of age. Cassidy doesn't understand health care. She only knows that she gets hungry, and she has her mother to care for her. This country, our nation, must decide what kind of nation we are and in which direction we're going to turn. In several days, we will decide here in Congress whether or not to override a veto, which I believe to be morally unacceptable. We cannot say no to our nation's children. We must accept the responsibility of caring for those who are most in need. That's not just my point of view. This bill is supported by everyone who's involved in delivering health care in this country. The American Medical Association, the American Nursing Association, and more, the College of Allergy, Immunology, and Asthma, the American Academy of Family Practice, the Federation of American Hospitals, the American Hospital Association, Catholic Charities, the March of Dimes, Lutheran Services, the U.S. Conference of Catholic Bishops, and more and more. Everyone understands that we as a nation must care for our nation's children first, because if our children are healthy, they'll be in school and be able to learn and gain the education that they require to compete in this global marketplace. But it all starts right here Thursday morning when this House must vote to override President Bush's veto. I believe we are at a precipice here in our country. It's getting dark, but it's not dark yet. We have to stand up for those who are among us that need us the most. Please reconsider your veto. Please consider your votes. There are people, our children need us. Please reconsider your votes, and I yield back my time.
Mr. Moran of Virginia.